Here is your stem, please. Just 10 seconds left.
Okay.
Right. So if you have read and understood, considering it history-taking station, please begin.
Yeah. Good evening. I'm Dr. Vijay. I'm a surgical trainee here. May I know your name, please?
Yes, Tom, 43 years old.
Okay, Tom. So, tell me what brings you here.
Doctor, I have pain in my legs, in both legs. I can barely walk, and then I must take rest. Otherwise, I can't just go ahead.
Okay, where exactly it is in your leg?
In my calves, both.
In your calf, both calves.
Yes.
How did it start, if I can know that?
I don't know. I just felt gradually that I'm unable to walk further. Now it has become so bad that I can't even walk more than 50 meters.
Okay, since how long you've been having this pain?
Quite some years, you could say.
Okay, so you're able to walk only 50 meters.
Yes, that's how bad that has become now.
Okay, okay. So anything else that increases that pain?
Oh, if I can decide to continue walking, that becomes worse.
Okay, okay. And does rest makes it feel better?
Yes, definitely.
Okay, okay. So, okay. Any um, so any other thing like any other skin patches on your lower limb? Any other ulcers or something?
No, it's winter, so it's dry skin. Otherwise, it's almost okay.
Okay, okay, okay. So, fine. Any nail changes or anything, any hair changes you have noticed in your leg?
No, not in particular.
Okay, okay. So, can I know if you have any medical comorbidities like diabetes or hypertension?
No, I'm good. I'm healthy.
Okay, okay. So, you told, can I know whether you have any habits like smoking or something like that?
Oh yes, doctor. Who doesn't smoke these days? But I smoke from a long time.
Okay, since when you've been smoking, if I can know that?
Oh gosh, you want me to really go back? When I was a teenager, maybe even younger, 12, 13
Okay,
years old. Yeah.
okay. How many do you smoke in a day?
Oh, I can't live without it. So at least 2 packs, you could say.
Okay, 2 packs per day. Okay,
Yeah.
fine. Do you also drink, if I can know that? Like
Mhm.
drink alcohol?
Yeah, occasionally with friends
Okay,
only.
okay, okay. So, okay. So, so any other symptoms which you would like to confide me?
Not particularly. It's just that I feel really pain and my legs go numb. It's just
Okay.
they become
How is
so.
it when you walk uphill or when you walk downhill?
Yeah, I haven't noticed there's no difference as such. It's just that my legs become so heavy and I must sit down and take rest. Otherwise, I can't just go.
Okay. Okay. Any tingling numbness in your lower limb?
Yeah, you could say numbness. Yes.
Okay. Which area in the leg you are having numbness? Tom,
My
if I can.
foot, you could say it begins with the foot and then it just goes up. I could even
Okay,
feel in my legs.
okay. Over the great toe or in the sole aspect of your
Uh,
foot.
yeah, you could say sole.
Okay, okay, okay. So any pulsations you feel in your limb? Any
I
engorged
don't,
veins or something?
I don't know, doctor.
Okay, okay. So have you consulted for this problem before, or is it the first time you're consulting for this problem?
Yes, my GP has recommended me to see you people.
Okay, okay, okay. So are you taking any medicines for this or for any other condition?
No, doctor. No
Okay,
medication.
okay, okay. And do you have any drug allergies, if I can
No
know that?
allergy. No,
Okay,
I'm not taking any medications.
okay. Does anyone in your family has similar
Similar,
problems, if I can
no
know that?
one. Not that I know of, no.
Okay, 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 okay. Uh, Fine. Any previous hospitalizations you have had for this or any other conditions
No,
to the
doctor.
hospital?
No,
Okay,
till date, nothing.
okay,
Yes.
okay. Okay, thank you, ma'am. Thank you.
You still have 38 seconds left. How would you end your history?
So,
The
this is
vital thing.
43-year-old male with who
Okay.
presented to the outpatient department with complaints of severe both lower limb pain below calf region, and
Yes.
he's unable to walk even 50 meters.
Yes.
Is otherwise healthy, and he's a smoker who smokes 2 packs per day.
Yes.
He's also complaining of mild numbness and tingling in the lower limb, more in the sole aspect.
Yes.
Uh, and there is no difference on walking up or downhill.
Yes.
So this goes more in the favor of vascular claudication.
Yes.
Uh,
So, what other differential diagnosis you'll consider?
uh, Other than this, I may consider even like I'll try to differentiate between neural claudication,
Okay.
which is due to spinal stenosis, but here it is vascular claudication that is due to uh, thromboangiitis obliterans or Burgess disease.
Okay. So, you'll consider spinal canal stenosis. Any other differential diagnosis? Please give me two more.
Varicose veins or veno-occlusive disease is
Okay.
another possible
All right.
differential diagnosis. The
Okay.
third is any
Disc lesion, maybe disc
yeah.
prolapse or something. All right. Please tell me what investigations would you ask for this patient?
Uh, First, I would like to check his vitals, and then I would like to see his ankle brachial index,
Okay.
and I would like to measure his systolic blood pressure in the arm and the systolic blood pressure in his ankle, and then I would
Right.
like to see that
Right.
ratio. If the ratio is less than point 0.8 or point 0.7, then it would come in claudication due
Right.
to vascular cause. As
Tell me about the images that can help you
imaging,
establish your diagnosis.
I would like to do Doppler ultrasound, arterial and venous,
All
and
right.
duplex scan.
Right.
Uh,
And
if possible, I would like to advise on CT angiography of the bilateral lower limb.
okay. And if patient cannot tolerate
If patient cannot tolerate, then probably MR angiography.
MR, yes, if a patient cannot tolerate the dye. All right. What treatment can you, or maybe you can also assess patient's gait and patient's balance.
Yes.
Right.
Uh,
What treatment can you suggest this
uh,
gentleman?
First thing is, I would suggest him to decrease his number of cigarettes per day.
Okay.
Second,
Lifestyle modification. Yes.
lifestyle modification. Second, I would start him on vasodilator medicines.
Yes. Okay.
Um, and if at all he's having any ulcers or something, then I would like to take general care of those ulcers, like regular dressing.
What surgical treatment can be offered if conservative management fails? What surgical options? can you offer this patient?
I would like to offer him a bypass, lower limb
Before that, endovascular stentings.
endovascular stentings. Yes.
If that doesn't work, then surgical bypass. If that fails, then last resort amputation. Okay, good.
Thank
Right, thank you. Now,
you. What are the areas of